Okay, so you have now had your first visit. So what happened? What did we do? Your first visit was an hour if you're a non-oncology patient, or it's an hour and a half if you're an oncology patient. So what we have done is gone through your intake form, so I know all the details about who you are, what your lifestyle is, what concerns about your health that you have, details that might be part of the puzzle piece in terms of figuring out why it's there, what's the root cause, and how to get you better. I will have probably given you more information that you can hold in your mind during that visit, because what's the truth of the matter is that there's just never enough time to do everything that we want to do. Thus, I'm making these videos. So, we've established a little bit of rapport between us. I now know you better. I know you as a human. I know you as a person, which is really, really important. The process of healing is something that's very different than the process of controlling a disease or a problem. To heal something, healing happens alone with you by yourself, but it also happens in relation to others. That is what healing energy and healing is about. So from now on, we are a team and we are in this together. I'm not going to tell you to do a whole bunch of things that you feel that you can't do and get overwhelmed. We're going to work at this together, and what I expect to happen is that everyone has different obstacles around their health and different challenges for us to overcome together. So we're a partner. We're partners in this. What's different about this process that it's really important that you know is that what you're used to in healthcare is a process of controlling your disease or controlling your symptoms. So our medical system right now is built around that, and it saves lives now. It's really important. You have high blood pressure, you have a medication, it brings it down. Awesome. Our process is really different. Our process is bringing in the piece of healthcare that is about how do we figure out how to engage your own body's natural abilities to heal and to repair, because it's come across a hurdle that's gotten in its way. And that's a really different process than controlling your blood pressure. Healing your blood pressure, for example, is different. And that's what we want to do. Sometimes often we kind of need to do both at the same time. And that's perfect. We can do both at the same time. So what we're doing is bringing in the whole deep science about how that happens in your body, how your cells do that, how your mind and body does that. And yes, that is a completely different process than what you're used to. Okay, so what we've done so far is I've collected the information mostly that I need in this hour. I will have told you about some tests that I want you to proceed and do. And I will have started you off on a few supplements to get the process started. This is just to start getting our plan in place. I want you to walk away with some actionable items to do, and to also start helping you feel better as fast as possible. In between your first visit and your second visit, I'm going to be analyzing everything and assessing everything. I'm going to have a look at everything that we talked about, and I'm going to be creating a plan over time that is your healing plan. And we are going to work on this for the next 3 to 6 to 12 to 2 years, depending on what issues we have to heal. So on your second visit, you will get a full assessment. Now, my challenge with this is that your assessment is fairly comprehensive. We will still also be in a process of collecting information, which will also go into that assessment over time. We can't do everything all at once, but you will get a comprehensive assessment and a direction for care, and we will start. No matter what we have in terms of lab testing, we will start, because the foundations of getting you better start in the same places for everybody. There will be a mixture of commonalities, generalities, and specifics that are specific to you, and that will evolve over the next couple of months, very much specific to you. You will also get, on your second visit, this lovely book, and you will either get it as a hard copy, which you can pay for, or I will send a PDF to you, and that is free. That is part of your fees for our care. And this talks about the foundations of your health. And because I always struggle with being able to educate people and having enough time to educate people properly about how their bodies work, and why the things that we are doing are important and how those things work, I have it in a book here so that you can read it on your own time. And perhaps I will be creating more videos to make it even easier for you. So look forward to this on your second visit. Now that brings me to how does your body work? What are the foundations of health? So there are macro level foundations of health and there are micro level foundations of health. So the macro level, what we know is that all chronic disease really revolves around kind of 5 things. That is getting enough sleep, your nutrition, your amount of exercise, your ability to manage stress and what type of stress load that you have on your body and if that's overwhelming you or not. And I'm going to throw in a 5th one would be your hydration. That's pretty simple. 6th one I'm going to throw in would be your environmental toxic burden, because that's a thing these days, and that is impacting our genetics, our genetic expression, and our diseases. It's really important for us to discuss those things because those things can be a blockage to cellular health. So we will be talking about all of those things, and for some of you, or many of you, or all of you, all of us, there'll be a couple of those that seem kind of scary or insurmountable. Whether it's nutrition for some people, exercise for other people, stress management when life feels like there's no option around stress. But we're going to be navigating those things together, because on a macro level, those are the things that determine your health. Those are the things that support your body in freeing up its energy to get better. That is how we stay well. And we know this. All of medical care knows this. All of our top 5 nasty diseases are all lifestyle based. And that peters into pretty much all chronic diseases. And certainly those factors then play with our own individual genetics, and how we genetically express our genetic risks. That gets into epigenetics, and these are going to be all things that we look at together. Okay, something that we also need to talk about is costs of things. So I have the ability to do all kinds of amazing and deep and sophisticated testing. Unfortunately, OHIP doesn't cover anything that I do, so everything is coming out of pocket for you, and that means that every person will have a different budget for us to work with, and that is also fine. I've been in practice for a very long time, so I've worked with no budget for testing, and I work with endless budget for testing. It's going to be something that, again, you and I create together. The way that we go about getting you better without testing sometimes is using my clinical knowledge and experience, heading down this particular path and direction, treating that. That can be diagnostic in and of itself, because you will either get better or you will not have improvement, and then I know it's the other pathway and I'll get you better that way. Testing wise, the tests in and of themselves are also often a little complicated and require some more teaching and some more knowledge for me to discuss with you the pros and cons of the test, what it's actually testing, how much it costs, and what information it's going to give us, and how useful that information is going to be to help us get you better. So we'll be going through that as well, probably more on your second visit. If we have enough time on your first visit, then we will have gone through that together. Alternately, I will give you a list of labs that I think will be useful, labs that I think are my priority, and I will give you links to read more about how they work and what sample reports look like. Part of our starting place for care often involves something that I call a reset or a body reset. Now, everyone's different. Everyone has different challenges and different obstacles, and we're going to start with whatever's the most relevant and most important for each person. However, I will say that doing a general reset is often a common starting place. Like I said, may not be where we'll start, but it's possible that we will. So what is a reset? A reset, I like to call it 3 weeks where we do things that are quite different for your body. And what's quite different is mostly we're going to be starting with nutrition, because nutrition is really, really powerful. And when we get our nutrition on track in combination with some of the medicines and nutrients or treatments that we'll be using, magic happens. Now, what do I mean by a reset? You know what? It's actually fairly simple. It's just, I'm going to teach you how to eat really healthy, and you're just going to do it for 3 weeks. And what is that going to do? It's not for the rest of your life, I promise, but it is going to really change your physiology in a really good way. After that period of time, you're going to notice it. You're going to get a lot of, your physiology is going to get a lot of relief. And the goal with it is to have a period of time where inflammation is lower in your body, nutrition and nutrient intake is really, really high, and your body gets a break from some of the things that irritate it or cause it inflammation. And you're going to notice that. You're going to notice that in your energy, you're going to notice that in your symptoms, you're going to notice that in your cognitive function, in your thinking. You might notice that in your sleep quality. And this is what the body needs to kickstart healing and repair. And we are going to get into a lot of detail about that on your second visit. And this is partly why we don't necessarily need to have all of the blood tests or other tests back for your second visit, because we have a starting place already that we need to reset things first, and then we're going to get more specific into what your body in particular needs and what direction we need to go after that. On the micro level, this is where we're looking into how are all your systems functioning. By systems, what I mean is your digestive system functioning properly, that you are assimilating nutrients and they are able to be processed and absorbed into your body to feed all of your tissues and help it to repair and regenerate? Do you have any particular deficiencies? Do you have any sluggishness in your system? Do you have low stomach acid? Are you having a hard time activating your enzymes? Are you constipated, etc.? Are your organs of elimination working properly? Are you able to get your toxins out? And toxins are coming in through your food, your diet, through air pollution, through stuff that we get on our skin, through flame retardants and Teflon, all kinds of stuff. Are you able to process that and get it out? So what organs do that? That's your liver, that's your lymphatic system, that's your kidneys, and that's your bowels. It's also your skin. All of those things are going to impact your cellular function and your cellular health, because if your cells are sitting in their fluid medium, which all cells do, and they're sitting in garbage, they're going to be susceptible to toxicity, to oxidative stress, and to carcinogens that could be a cause for cancer or could be a cause of chronic inflammation. So our detoxification ability is really important. And then we have things like circulation. So if we think of a stream on a mountaintop and it's moving really quickly, It's really clean, it's really clear. Theoretically, you should be able to drink out of that. And then we think of like the Humber River or the pond in Hyde Park, where it really stinks and it's not moving. And it's not moving because, well, there's no ability for it to move. And what happens there is then toxins accumulate, the algae accumulates, and then we have bacteria move in to feed on the toxins. And we just get more and more toxicity. It's the same thing in our body. So our circulation and our constant circulation and our movement and our activity is really key for getting nutrients into the cells and getting our garbage out. So circulation is key, and that's your lymphatic system, and that is your heart and your lungs and your blood vessels and your vascular health. So those things are also really, really important. And then we have your immune system. So what does your immune system depend on? Well, it depends on everything else. So does it have enough nutrients to keep it going? Does it have our detox abilities working properly to keep the toxins out and not annoy our immune system? So is our gut functioning properly? Circulation is also really important for your immune system. Oxygenation is also really important for our immune system. So every system in our body is reliant on everything else. Everything is interconnected and not working in isolation from each other. Then we look at our hormones, because hormones play a key role in everything as well. Hormones can be anti-inflammatory and can help create energy and do all kinds of things, help us repair and grow. So we need to look at our hormones and our hormone system and make sure that that's in balance. We need to look at our nervous system and figure out if we are more in fight flight or we are more in parasympathetic mode, which is nobody these days. And that plays a huge role on the health of your cells and tissues and other organ systems as well. So being in constant flight affects your sleep, can affect your stomach acid, can affect your gut health, can affect your bowel movements, can affect a million things. Then we might look at even more micro, which I started to allude to already, which is your cellular functions. So cellular functions, well, are your cells individually able to make energy properly, or are you nutrient deficient and are struggling with that, or are you under too much oxidative stress that even cellularly you're having trouble making energy properly? These are all things that we're going to look at in terms of your health, the health issues that you're coming in with, because by healing your lifestyle and healing your body and all of its systems and getting everything back into balance, this is what we're looking at in terms of how we heal a chronic disease issue and also prevent one.